Aortic stenosis. Aortic stenosis is a condition characterized by narrowing of the aortic valve, restricting blood flow from the left ventricle into the aorta during systole. This results in increased left ventricular systolic pressure, compensatory cardiac remodeling, and may ultimately lead to heart failure. Peak incidence. Aortic stenosis is most common in individuals over 65 years old due to age-related degenerative changes such as calcification of the valve. A bicuspid aortic valve may cause earlier onset of aortic stenosis, typically in those under 65 years old. Pathophysiology. Congenitally, a bicuspid aortic valve increases the risk of early valve degeneration and stenosis. Rheumatic fever. This can cause inflammation and subsequent scarring and fusion of the valve leaflets, leading to stenosis. Calcific degeneration. Age-related calcification of the aortic valve causes leaflet stiffening and obstruction to flow. Not all patients are symptomatic. Common symptoms when present include chest pain, dyspnea, palpitations, fatigue, and syncope. Signs. On auscultation, an ejection systolic crescendo-decrescendo murmur is best heard at the right upper sternal border, which radiates to the carotid arteries. There may be a narrow pulse pressure. Fourth heart sound S4. This suggests left ventricular hypertrophy. A palpable thrill over the aortic area. A soft or absent second heart sound S2. And a slow rising, low volume pulse, known as pulsus parvus et tardus. Classification. Mild aortic stenosis has a valve area of more than 1.5 cm squared, with a mean gradient of less than 20 mm of mercury. Moderate aortic valve stenosis has a valve area 1.0 to 1.5 cm squared, with a mean gradient of 20 to 40 mm of mercury. Severe aortic valve stenosis has a valve area less than 1.0 cm squared, with a mean gradient of over 40 mm of mercury. Diagnosis. Careful history and physical examination should assess for typical features and murmurs. An ECG may show signs of left ventricular hypertrophy or arrhythmias. An echocardiography is the gold standard for visualizing valve anatomy, assessing severity, and measuring gradients. A Doppler ultrasound assesses the flow velocity and pressure gradient across the aortic valve. Complications. Complications include heart failure, arrhythmias, for example, atrial fibrillation and ventricular tachyarrhythmias, infective endocarditis, pulmonary hypertension, stroke, hemolytic anemia due to turbulent shear forces, and sudden cardiac death. Management. Asymptomatic patients with severe aortic stenosis may not require immediate intervention, but should be monitored with echocardiography. Surgery is considered if mean gradient is over 40 mm of mercury, left ventricular dysfunction, and onset of symptoms. Symptomatic patients require aortic valve replacement AVR. Surgical AVR is standard for low to moderate risk patients. A transcatheter aortic valve implantation, also known as TAVI, is preferred in high-risk or frail patients. A balloon aortic valvuloplasty may be used as a temporary bridge to surgery in unstable patients. Medical therapy. Beta blockers and diuretics can relieve symptoms but do not halt disease progression. They are used primarily in non-surgical candidates. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today